Okay, it's 10:01, so we'll get things going. Hello, everyone, and welcome to our workshop today. I'm Christine Kilpatrick, Family Support Consultant on the education side at Vermont Family Network. All of our workshops, including the previous ones, are recorded and can be watched on our VFN YouTube channel. The link is on our website, which is vermontfamilynetwork.org. Everyone who registered for today's workshop will receive a follow-up email with a link to this recording and a PDF of the presentation with live links. Vermont Family Network has been serving families of children with special health needs and disabilities and the professionals who serve them for more than 30 years. We are the federally designated Parent Training and Information Center, the Family to Family Health Information Center, and the chapter of both Family Voices and Parent to Parent USA. VFN and Hireability and the Agency of Education are partners in transition initiatives, and we work together to get transition information out to families and professionals. The development of the VFN Transition to Adulthood Toolkit was developed through a grant from Hireability Vermont, and hard copies of the VFN publication, The Family Guide to Transition Services, was generously funded by the Agency of Education in Vermont. We value and appreciate these collaborative partnerships to bring families the best information and resources to assist them in having meaningful participation in their youth's transition plan and to promote better youth outcomes as they move towards adulthood. Today's workshop is being recorded, so please keep that in mind as you share information about your situation. This session will include live captions. If you want to turn them on, click on the three dots by More, then Captions, then Show Caption. If you're comfortable, you are welcome to turn on your camera. You can ask questions using the chat box, which you'll see excuse me, at the bottom right of your screen. We will save time at the end of the presentation to answer questions. Feel free to share information or links to resources that you found helpful in chat as well. We know that you all can learn a lot from each other. Today's workshop is Vermont Center for Independent Living, an overview of supports and services. I'm excited to introduce you to Peter Johnke, Deputy Director of the Vermont Center for Independent Living. Peter is hard of hearing and has low vision and doesn't drive. He is a carless traveler and advocates for better public transportation services. He is an adept user of assistive technology and a member of the Vermont Assistive Technology Advisory Council. In his role as Deputy Director, he is the leader for VCIL's Community Access Team. The team provides ADA technical assistance throughout Vermont. Thank you so much for joining us today.
Thank you. I'm very happy to be here and look forward to interaction with everybody here. Many of you may have already had some contact, if you've had contact with VCIL in the past, with my colleague Dick Moreland. He was actually going to do this with me, but he's out on medical leave. So I'm doing this by myself, but he definitely will be back, and some of you may already be familiar with him. He is our information and referral specialist and also heads up the equipment distribution program, and I'll talk a little bit about more of that a little bit later. So there's a lot of different services that VCIL provides, and I thought the best way to do this would be, I'm going to share my screen and go through our website sort of as a guide. Let me get to that. There. So this is when you go to vcil.org, this is what you see. And I'm going to go under this tab for services. And then you see these other boxes here. And I'm going to kind of just go through each one of these so that people have an idea of various services that we provide. The first one that you see here, this vaccination services in Vermont, we are in the process of doing more of this. During the pandemic and after the pandemic, especially when the health department stopped providing information so much on getting vaccines out and tests out and all that stuff. We really stepped up because we're very much aware that people with disabilities are much more prone to have significant complications if they come down with COVID. And many already have long COVID. And also, people with disabilities are often have difficulty in transportation, getting out of their homes. So to even go and get a vaccine was very difficult. So we set up a program through some funding that we actually provided some in-home vaccination services, and we're hoping to start that up again pretty soon, and we'll be posting that and letting people know when that starts. But we were actually noted at a national meeting the week of the 22nd in Washington, D.C. We were talking about all this disaster mitigation and recovery and what we need to do around all these things, including COVID. And it was noted that VCIL has distributed over 500,000 test kits across Vermont. Basically, just about as many test kits as there are people in the state, more actually, I think. So that's something we're very much on top of, and we hope to continue going along. So if I move to the right, my right, the technical assistance in understanding and implementing the ADA. This is the, as an introduction, this is the team that I head up. We have a grant from the New England ADA Center to provide ADA technical assistance to anybody who calls in Vermont. So if somebody has a question, isn't sure, has a question about accessibility, give us a call, and we'll try to address that question. If we can't, we'll definitely reach out to the ADA Center in New England and try to get the right answer. So we do a lot of that, but we also do on-site assessments and give businesses and different nonprofits have called us and inquired about what do I need to do to make this accessible? What do I need to do to make it more accessible? So we've done a lot of that work over many years. We've done everything from libraries to museums to individual businesses, all kinds of things. There's no cost for any of this. We do accept some donations. And we provide a basic report on, what people need to do to make improvements. And we also point out, which is really important, this isn't just about physical access, removing barriers, putting in ramps instead of stairs, but it's also about programmatic access, which means making sure the programs are accessible to people who are blind, people who are deaf, and so on, so that everybody has the same opportunities to participate. One thing that I work with cities and towns a lot. I've done presentations for many towns through the League of Cities and Towns in Vermont. I've worked with a lot of different towns on accessible voting. But one thing I also frequently have to remind towns about is that sidewalks are considered a program. And if any of you have been out in most places, sidewalks are pretty deplorable, especially for people using mobility devices. It's really awful. And so that's something that I really push to make sure towns are aware that that is a requirement for them under the ADA. They need to put it in their transition plan. So there's a methodology and a timeline for getting the sidewalks in compliance. This past year, the legislature did pass a law that now allows people to be, if you're in a wheelchair or walking, it's okay to be in the street. And I mean, I'm glad they passed the law, but that's not addressing the problem because many times sidewalks are simply impassable. And then moving again over the Deaf Independence Program. This is a special section of our um, peer advocacy counseling program, specifically for deaf, hard of hearing, deaf, blind individuals. We have an advocate, Val Hughes, who is deaf herself and fluent in American Sign Language. And so she really heads up this across the whole state, working with deaf and hard of hearing people to help them, meet their goals around independent living. And I'll get a little bit more into that whole thing as we go through some more of these other programs. The Home Access Program has been around for years and is up and running and been very successful. The program provides ramps and door widening and also bathroom modifications to eligible individuals. There are income requirements around 80% of HUD guidelines, and there is an upper limit on the property values. I think it's pretty high, something in the $300,000 range. And if you have need a doctor's note that says yes, you need a ramp or you need bathroom modifications, you can apply for that program. We are constantly doing those, putting in ramps, doing bathroom modifications. The ramps obviously work on a lot during the summer. It's pretty difficult or less easy to do them in the winter time, but we have done some in emergency situations. We use modular ramps so that if they're not needed, they can be taken down and moved somewhere else. And those different modular components can be reused. And there's, excuse me, there used to be, some of you may know, there used to be leverage funding of $1,000 for a ramp or $2,000 for a bathroom modification. That's been taken away. And so now we just put, as soon as an application has been processed and we have all the documentation, it's been approved, they go on the waiting list and just everybody moves up through the process. It's not a quick process because the ramps are certainly quicker than bathroom modifications, but we send out an access consultant to look at the site, do a site assessment, send us a report. And that report we send out to contractors. These contractors have all been vetted and have worked with VCIL, have had education about how to work with people with disabilities. And so then we get bids from those contractors, and then the process starts. So it's not necessarily quick. It takes a few months. And then as right now, excuse me, a lot of contractors are backed up. And so it's taking a little bit longer for them to get to different projects, but it is moving along at a steady pace. Information and referral and assistance. I mentioned this one to earlier. Nick Moreland, Nick Parker has headed up this program for quite a while now at VCIL. So any general information and referral questions would go through this, through him. He can do research and get back to people if he doesn't have immediate answers. Also, if people are interested in the peer advocacy counseling program specifically, they would go through him. He does the intake for that process, and then those intakes get sent to the PAC coordinator for that particular area, and then get assigned to a specific peer advocate. Many of you may be familiar with Meals on Wheels. It's similar to the Meals on Wheels program run by the Councils on Aging. The difference in our program is we're serving people who are under 60 years old, and because of their disability, they're not able to prepare a meal, or they don't have access to food. They're in a really rural area and have no access to transportation, for example. and they have limited access to food, then they would be also eligible for the program. But most of the people are, their disability doesn't enable them. They don't have the capacity to cook a hot meal, so they get put on the Meals on Wheels program. And typically, they're put on the program for 5 meals. For long-term Meals on Wheels, they're put on a program for 5 meals a week. And depending on the meal site delivering those, it's the same sites that deliver them for the various councils on aging in different places. Sometimes in the rural areas, they may only deliver twice a week, but so then they'll deliver, 3 meals one day and 4 meals the next day, or something. Some people are on 7 meals a day, depending on the need. So that they even though they may not get delivered daily, they do get delivered meals regularly. One thing that's changed over the last probably year or so, and this came about through health regulations. They used to be able to just leave a meal if they can get an answer at the door, but we're no longer allowed to do that. We can't put them in, if somebody leaves a cooler out, or a styrofoam cooler or something, put them in there. That's no longer allowed. So we have been able, for people, if they have the capacity to have an outside electrical outlet, we can get them a small refrigerator if need be, so that if they're not going to be home, then the meals can go in there, and so they won't miss a meal. So that's one thing. When they set them up, they make sure to find out that the person is home. And even if the meal site delivers every day, but if this person says, "Hey, I'm never home on Wednesdays at delivery time," they'll skip that day, but on Tuesday they'll bring 2 meals, so that they have the meal for Wednesday, and then they'll do the regular delivery on Thursday, and so on. So they really work with everybody to make sure they get the meals that they need. We work closely with all the food shelves and stuff, so we also can provide additional information to people who do have some issues around food security, so that they can get some additional food. Further on down here as we go, the funding for assistive technology, and this is the Sue Williams Freedom Fund. At the moment, right now, that fund is out of money. We will have money again in October. We are still accepting applications. Unfortunately, it's a very underfunded program, and based on like people who were on the waiting list from the past year, when we ran out of funding, and then applications we were receiving, and now I anticipate we will probably run out of money in March. So if you have a need, get an application in as soon as possible. Application is pretty straightforward. We need a doctor's note, we need income verification, and then we need whatever the item is that the person wants. They can choose where they want to get it, whether they want to get it off of Amazon or get it from a equipment dealer. There's a lot of latitude in what is considered assistive technology or equipment. I mean, it can be an air conditioner if somebody has MS or some other disability that requires them to have that. We can do some limited education. There have sometimes been some programs for people with autism. It's a structured, like 6 weeks kind of program, different things like that. And we can do that as long as it's a structured, regular kind of education that would help them improve their independent living ability. So it's pretty broad in terms of what we can do. I mean, whatever they're asking for does need to be related to the disability. The most the grant can pay is $1,500, and there is a leverage funding or copay of 20%. If the item is between $1,500 and $1,800, then it's a flat $300 copay. And if it's over $1,800, then the copay is whatever the amount over $1,500, which is the maximum the grant can award. And you aren't limited to one item. So if you have a couple of different things, as long as the total isn't more than the $1,500, You can get more than one item. You are only eligible once every 4 years. Um, Typically, something we changed in the policy recently was you could only get the you could only apply once for the same piece of equipment. So if you got a wheelchair once, you can't apply again, even if it's 6 or 7 years later for another wheelchair. Um, the change we did there is the exceptions to that is after 4 years, if you need new hearing aids that you got before, or new glasses that you've gotten before, new dentures. That's also something this program pays a lot of. Um, then we can do those things more than once within that 4 year limit. Um, I would say the program probably does more dentures and lift chairs than any other thing, but it's a broad range of stuff. If people are trying to get out of a nursing home, they do go to a priority. Um, and for that, we can pay limited amounts of money for personal care attendant services while they're transitioning until they get those in place. Um, um, the other thing that also takes priority is if there's a parent with disability who is in danger of losing custody of their children, they also would get priority if they needed some kind of assistive technology so that they could take better care of their children and not lose custody of them. So those are some specifics around that program. And all of this is laid out on the website. You can get Sue Williams Freedom Fund applications off the website. I mentioned the home access program earlier. That application is not on the website because we like to pre-approve somebody. There's just lots of little nuances to the program and the requirements. So we want to go through and make sure somebody's actually eligible before we send them the application that they fill out. Things like the property value and that kind of stuff. Now, the peer advocacy counseling program, we have peer advocates around the state. We have offices in Burlington, Bennington, Rutland, and Brattleboro that all have peer advocates serving those areas. A peer advocate always works with an individual with a disability to work on specific goals. They are not case managers. Think of them more as mentors. So if somebody's interested in the peer advocacy counseling program, we always have a direct conversation with them. So if you're making a referral, we can contact them, or you can do a three-way call so we can have a discussion and really clarify what the peer advocacy program can or can't do. And the person needs to have some ability to be self-directed. So because the person isn't going to be able to work with them in the same way that a case manager would work with them. The Vermont Equipment Distribution Program, that's another program that Nick typically would be running. Right now I'm taking over that for him. This is a program through the Department of Public Service under statute. They're all over the state, all over the country, sorry. And it provides telephone equipment and other kinds of equipment, specifically so a person can communicate where they can't use a regular telephone, or to communicate the way other people have communicated. And we work closely with the Vermont Assistive Technology Program to help people figure out what equipment they need, so they get the right piece of equipment before we order that for them. And it can be anything from an amplified phone, a phone that displays captions. There are phones for people with cognitive disabilities, so the buttons have pictures of the person they want to call, if that's easier for them to remember who they're trying to call. There's all kinds of things with special kinds of headsets, Bluetooth devices. We do provide sometimes a laptop computer, especially for a person who's deaf or hard of hearing, that needs to have some capacity to reach referral services with an interpreter for the deaf to be able to communicate. So there's all kinds of things we do there. One of the, I think, most underutilized pieces of equipment, it's old-fashioned. It's called a TTY or a TDD, a little kind of typewriter device typically had been used years ago for people with who were deaf to, work with a person. So, the person they're calling would get a text if they had the same device, or an interpreter would see that they're calling and just interpreting that to a hearing person. But this also works wonderfully in the same services for people who have a communications or speech impairment. So they can also call, use the device to communicate what they want, and the person that they're communicating with, if that person's speaking, it can be set up so the person with a speech impairment can hear their friend or family member, whoever they're calling, directly. And so they can hear them directly, so they just respond by typing, and then the interpreter can relay that. So there's lots of assistive technology. It's very difficult to keep up with it all, but I'm very happy to be involved with the Assistive Technology Advisory Council to try to really stay on top of all the different kinds of technology that are out there. We do have workshops from time to time. We actually are having one tomorrow on ABLE accounts. And if you're not familiar, this is a special sort of savings account that people with disabilities can put funds away in to later be used for things that they may need to continue their independence related to their disability. And all the funds in that account don't count as a resource in terms of benefits and things of that sort. Other trainings that are coming up are hoping to do, well, we are doing one on how to avoid Social Security overpayments. And then we have a couple others we're in the works around service animals. And this last section is the youth transition program. This group, your group, of course, are very involved with youth transition through hireability. My colleague Safakor has been doing youth transition for VCIL for a number of years, working in schools with all the different teams there to help youth transition either out of from school into the community or into higher education, depending on the need. And that's a program that will be continuing. It slows down a little bit during the summertime, and then oftentimes picks up during the school year when we're going out and doing a lot of work with schools directly to help that whole process of transitioning. There's all kinds of resources that we have. We have information on how, if somebody is trying to hire their own personal care attendants, we have a toolkit that help them figure out how to go through that process. There are all kinds of resources, as I mentioned earlier, on assistive technology. We routinely advocate before the legislature on a whole variety of topics in terms of really this more is around systems change and looking at what kinds of things need to be changed within the system to make improvements. I am, as mentioned earlier in the introduction, I'm an advocate for public transit. I sit on the Public Transit Advisory Council and some other local, that's a statewide council, also some other local stakeholder groups around transportation. And I'm also the chair of the Transportation Subcommittee for the National Council on Independent Living. So I've also worked a lot on the national level Um, one big win we got on the national level is it now will be much safer for people with disabilities using wheelchairs and other mobility devices to be able to fly. That was downright dangerous before, um, and it'll take a little bit of time to get some of these new regulations and rules into place. But we're very pleased with a lot of the advocacy work that was done nationally with a lot of different organizations. The Paralyzed Veterans of America probably was the lead on it. The um, Federation for the Blind was involved. There were a number of different organizations, including the National Council on Independent Living, that really did a lot of work to push that through and appropriate changes in terms of requiring training for airline personnel, among many other things, to make it safer for people with disabilities, and especially those using mobility devices to be able to fly. I think I've covered most of it. Like I said, this is an overview. If anybody has specific questions about one of the programs, one thing I don't think I mentioned with the Vermont Equipment Distribution Program is that program, there is no copay or leverage funding for that program. It's you can pay up to $750 for any piece of equipment for that particular program. So I will mention one other program that just started and it will end at the end of this September. So it's a very short-lived program. There's a very small amount of money to be funded, but it's a flood relief program. And it's meant for people who have lost something during either the 2023 July flood or the 2024 July flood that wasn't replaced by FEMA, that hasn't been, they haven't gotten reimbursed for that. None of these programs will reimburse somebody. We pay vendors directly, but that program can be used to replace something that was lost in the flood. If somebody lost their cell phone, we can pay for the device, not ongoing cell service. Like I said, we just launched this program the middle of July. I've had one application so far for somebody needs assistance in paying for a storage unit because they've had to move into a much smaller RV from their house, and they have to have this big storage unit to prevent their belongings from getting mold and that kind of thing. So that would be something that would be appropriate for the program. In the application, we suggest a limit of around $750, but that's not hard and fast. We can go higher than that, probably not more than about $1,500 or so, just if somebody can, demonstrate the need. So that program, and because there's only $20,000, so I mean, if we did everybody at $1,000, we'd get 20 people. So like I said, it's not going to last long, but we are taking applications and starting the process right away. We don't need any extra information from those people. We aren't asking for income information. We're not asking for a doctor's note or anything like that. We do need some sort of information that they are a person with a disability. It doesn't necessarily mean that we need a doctor's note or a social security letter, but if some other organization that's working with them, a case manager or a social worker, can tell us that yes, this person has a disability, that's certainly sufficient for that program. That's not up here, and we're not going to put it on the website because it will go away before we can really get the word out. We did launch it. I launched it to case managers at Capstone just before I left to go to Washington around the 15th of June. And then yesterday, I also presented to the Vermont Chronic Care Initiative nurse case managers of that program as well. So hopefully the word gets out and people will take advantage of it, even though it's not a big program and won't last too long. So I will stop there, and we can go to questions.
Thank
And
you.
I'm
Thank you, Peter, for sharing this great information. Before we get to questions, we're going to take just a short pause to ask you to complete the evaluation for this workshop so that we can make improvements and fulfill our grant requirements. You can see the link in the chat, and we're actually going to give you a minute right now to complete that. And then we do have several questions in the chat, and I will read them for Peter, and we'll get you that information. Thanks. Okay, folks, hopefully you've had a minute to do that. And Peter, if you're ready, I'll start reading off some of these questions.
sure.
Okay. Let's see. The first one is the registration link for the ABLE account on the website that you were displaying. And I assume, Peter, that is the website for Vermont Center for Independent Living, because somebody asked for that clarification as well.
Okay. Yeah. No, it isn't on the website. But if you give me a moment, I can probably put it in the chat.
Oh, great.
So let me do that if I can do that quickly. Just a moment. I'm not finding it quickly, but I will send it out right after this.
That's great.
And
Thank you.
that sure.
Thanks, Peter. Next question, how do you take referrals? Oh, do you take referrals? And if so, how?
So the for all of the different programs, I mean, if you just call the main VCIL number and say, you're interested in X, you will be, transferred to whichever is the correct program. So the only program that really sort of needs a form, not even a formal referral, but that has an intake process is the peer advocacy counseling program. And as I said, there is so that person would call, say, I'm interested in having a peer advocate. They would get transferred either to myself, or we have a temporary person working right now while Nick is absent. And they would fill out an intake. They would have a conversation with the person to make sure it's a fit for the program. They would then fill out this intake form that would go to an advocate, and then the advocate would be calling that person within a couple of days. all the other programs you can actually really call directly. Um, in terms of the emails and contact information is if you go to the website and click on any of those programs, you'll see the contact information for each program. And you can contact those directly if somebody needs Meals on Wheels. You can contact the Meals on Wheels program staff directly and, say they need a referral. And then if it's what we call short-term or emergency ones, they can do that over the phone. And then we can send out an application for Meals on Wheels if it's a longer term process. Um, and as all the other programs, typically the equipment distribution and Sue Williams and a home access program, they all have actually applications. So it's just a matter of um, calling and getting an application. And anybody can call and get an application. And then pass it on. If you're working on behalf of somebody, you can call and get an application. Or if a parent is needing a modification for their home for their child, they can call and get an application and process it that way.
Thank you, Peter. We did have a few, there are more in the chat, which I'll get to, but we did have a few that were sent ahead of the workshop. So I have a parent who asked, what's available in the Northeast Kingdom for supports and socialization for folks out of school, as well as public transportation?
I did see that question ahead of time, and that's a tough one. The I would I don't know of any formal kinds of organizations, but I would look for what interests the children might have to try to see if there's a program that might be involved in that. Obviously, the summertime, there's lots of camps going on all around the state that can be activities for anybody. And also keep in mind that all of these programs that are open have to be open to people with disabilities. So if that becomes a barrier, definitely call us and let us know about that, because that would definitely be a violation under the ADA. Transportation is probably more difficult in the Northeast Kingdom than other places. I don't know if people have tried the public transit provider there, which is Rural Community Transit. There are some programs that they have, one that's known as O&D, or for older and disabled persons. So that program should be able to do some transportation, on a occasional basis. It wouldn't be necessarily daily or regular transportation, but if there's some event a person needs to go to, or if they're not eligible, say, for Medicaid transportation and they need to get to a doctor, or in the sense of if they're trying to get to one of these activities during summer for socialization, the O&D program should be able to provide them with transportation. If you have problems there, running up against problems in that regard, don't hesitate to reach out to me, and I'll try to run some interference and figure out what's going on.
Thank you, Peter. And another one from a parent. Do you know what services are available for students in Vermont as they transition from school to the real world?
I would say, when you say the real world, are they trying to go to work? Are they trying to, what is their goal in terms of transitioning to higher education or work? If they're transitioning out of school, they're certainly would be eligible to work with a peer advocate counselor. If they're trying to go to work, because of your partnership with the Higher Ability, would certainly be probably one of the best places to go in terms of people trying to work. If they're needing just like community connections, knowing what services are available, that would be something that our peer advocates could help with. And we do have a peer advocate who covers the Northeast Kingdom, who can certainly reach out to those people.
And a question from the chat. Is there a program to help maintain cleanliness, organization in homes and apartments to those in need?
Not, to be honest, not that I know of. It's been a big problem on a number of levels. Even for people who are eligible for, say, there's a program for moderate need, which would include housekeeping services. Even if people are eligible for that, the agencies don't have enough personnel to fill those slots. So it becomes a real problem in terms of how to help people through that. I don't have any good resources on it. We do have, there are a couple of programs in certain areas of the state. There's not really a statewide program anymore, but our peer advocates do have a little bit of experience in helping people who have hoarding issues, but not really somebody who could work with them on an ongoing basis in terms of um, helping them keep organized or the house. They could teach if they had, if they felt that they needed to learn the skill how to do that, and then they would be able to do that on their own. That would be something that an advocate could help with, but it wouldn't be able to be an ongoing kind of process. But the peer advocates could certainly help with teaching them the skills and how to become better organized.
Are there programs for continuing education? Another question.
In my experience, there is, I mean, the existing programs, CCV, or actually now I think it's called the University of Vermont, has a number of different programs. There's some programs where students can take classes for free. And again, all of these things, especially through the school system, would have to be open to people with all kinds of disabilities. The Vermont Technical College might be a way to transition somebody if they weren't sure they were looking like an academic situation, but more of a hands-on, what can I learn so I can go to work. That would certainly be one thing that I think would be worth exploring because they do have different programs there. And to my knowledge, they're not all exclusively on the Randolph campus. They have some in other parts of the state as well.
Great. Another question that was sent ahead of time. Do you know the status of the bill regarding compensation for parental caregiving?
I don't. I started to look that one up because it was sent ahead of time, and to be honest, I didn't find what I was looking for, but that is something that I will definitely follow up on and get back to people on.
Thank you. Another question from the chat. Will programs such as Meals on Wheels be helping short term with flood victims? Do you know?
Absolutely.
Let's see. We've got them all. I think we might have covered. If anyone has any further questions, now would be the time. You can put them in the chat, or you're welcome to unmute and ask your question. Guys, this has been a lot of great information, Peter. Wow.
And
really.
And certainly don't hesitate to reach out, if you, I should have asked this, and just reach out. I won't put it in the chat because it's almost too easy, but if you can reach me at peter@vcil.org.
Thank you, Peter.
But I will definitely follow up on those other two things with
looks like Lori might have a question. Go ahead, Lori.
Right.
I did find the ABLE accounts info session, so I put it in the chat.
Oh, great. Thanks so
So if
much,
you're
Laurie.
going to yeah.
Thank
And my
you.
other question is, can you just give an example of what peer advocates could do? Like if someone did call and they wanted a peer advocate, maybe a couple of examples of when you would call for.
Sure. I think the thing to keep in mind in terms of a peer advocate is, do you have a goal, a specific goal in mind that you want to accomplish so that you can be more independent? Is it going to school? Is it finding a job? Is it just learning what other resources are in the community? Is it um, connecting? Somebody asked earlier about how you connect with different social kinds of things. If that's something you haven't, been real comfortable doing in the past, how can you do that? Um, Finding different housing, of course, that's a really tough issue right now with the housing shortage, but that's a goal that a lot of people have right now that we're working with a number of people on. But it's you know do you have a thought about, oh, I wish I could do X, but I don't know how, or I wish I had X because it would help me do this. Any of those kinds of things, um, an advocate can help with, because um, we like to frame things in a sense so that they have here's where the person is, here's their goal, so this is a beginning, and when they accomplish that, this is an end. And it's certainly not limited to one goal, and they can finish one goal and say, hey, great, that's been great, thank you. And then 2 months later come back and say, hey, I want to work on this now. So it can be, it's not an open and shut thing, one kind of thing. So that's, I think, the best way to think of it in terms of what an advocate can help with. I mean, it can be some short-term things too. We have a person who needed to file a grievance with the police department, and so we're helping them figure out how to file a grievance with the police department. Those kinds of things. Yeah. So.
Okay.
That's great.
Thank
Very comprehensive. Any more questions? Not seeing any more in the chat, and that was plenty of questions. Thank you so much, Peter. That was great. So, we have, just to let folks know, we have many more interesting workshops coming up, and you can find details about those on the homepage of our website, vermontfamilynetwork.org, along with the links to the previously recorded ones. We have tons of information on our website, and getting connected with us is easy. You can follow us on Facebook or join our closed Facebook page if you're a parent. We have 2 closed groups, one for all parents of children with disabilities or special health needs, and one for those with adult children. You can also sign up for our monthly e-news or check out our YouTube channel, and we're here to help. Please contact us by phone or email. And I just want to say one more big thank you to Peter. That was a fantastic bunch of resources, mind-boggling, really. Thank you. And thank you to everyone for participating today. And I hope you all have a great day.
Thank you very much.
everyone.